screen is actually what's being recorded.
Yep, that one right there.
Okay.
Hey, welcome to the PBM Reform Podcast, part of the Pharmacy Podcast Network. I'm the founder of the Pharmacy Podcast, Todd Urey. I'm excited when I get to have people in the studio because it's just more fun. I mean, Zoom is one thing, but I am zoomed out. I have Zoom fatigue, and it's been conference season, so it's been wonderful to spend time with many of our pharmacists and pharmacy innovators throughout our profession. Just got back from the NASP, the National Association of Specialty Pharmacy. Thank you so much, Sheila Arquette, for allowing us to be your press and media sponsor. That was fun, and that series is coming out. We were also at SoftWriters user conference, and that was also an enjoyable time with our long-term care pharmacies. Long-term care is changing, and we see it going both ways, from community pharmacy to long-term care and long-term care services at home, as well as long-term care pharmacies now starting to get into home and at-home care. So this is going to be an interesting year coming up in 2024. PBM reform is a big part of our conversations here on the Pharmacy Podcast Network. I like having resources and people in my life as well as in my community who we can rely on and talking with us. I want to welcome back to the show, to Pharmacy Podcast Network, Erich Cushey from Curtis Pharmacy.
Thank you, sir.
Hey, what show were you on originally? I can't even remember. We do too many shows.
We were talking about RxSafe strip packaging and
oh yeah,
from
RxSafe
pharmacy. Yes,
exactly. Sir. We'll be working with RxSafe at the NCPA event. They're going to be doing a panel discussion on growing your cash-based business as well as getting ready for the DRP apocalypse, which is going to be part of our conversations today. But my next guest from Montgomery, you're a Pennsylvanian, so that's good.
Yeah.
Is Seema. I want you to introduce yourself.
Hi, my name is Seema Kazmi. I'm from Bucks County, Pennsylvania, specifically Morrisville, Pennsylvania. I've been a pharmacist over 17 years and practiced in community pharmacy, pharmaceutical industry, as well as managed care.
And you're on the board of the Pennsylvania Pharmacists Association, my own association. So shout out to the PPA.
Yes. And I also served as Speaker of the House of the Maryland Pharmacists Association as well.
All right. So I want to jump in. And if you're watching on YouTube, you'll see all three of my guests throughout today's recording. However, you're probably listening on podcasts. It's fun to have people in the studio. Seema, I'm glad that you came out. How long was the drive on the great turnpike of Pennsylvania, my least favorite road to travel in the nation?
You know, some parts I took the scenic route. So I saw a sign that says dangerous mountains ahead. And I forged on, but I'm here. So it's very beautiful.
Yeah,
It
is a scenic. It is a scenic drive. I do love Pennsylvania from the scenic perspective. I'm not sure if you realize this, Erich, but did you know that Pennsylvania gets 78 days a year of sunshine, and that's it?
Well, today's certainly one of them. It is a glorious day.
It is a day. And Erich, you drove your motorcycle out here, huh?
I did.
See, I got to get back into biking. We have, I've lost that feeling that you get from riding, that you only get from riding, and I want it back. So that's a little side note for our listeners, just about us and our guests. Seema, I'm going to start with you. Give us a little background on your interest in PBM reform. I kind of want to kick things off with an article that you brought to our attention, which was Kentucky's Attorney General office files lawsuit over alleged insulin pricing scheme. And this is an interesting time where we know that that insulin's been a sensitivity. It's been in the national news a lot. But just give us your overall viewpoint on PBM reform and the impact specifically around affordable insulin.
Sure. So the Inflation Reduction Act capped insulin for seniors and those on Medicare for $35 a month. Unfortunately, that law does not apply to commercial plans. So states across the country have basically passed laws to impact populations that get their insurance through commercial and employer groups. And so not only Kentucky, but multiple states, California, Ohio, Kansas, Mississippi, they have all filed lawsuits against manufacturers and pharmacy benefit managers in their role in the insulin pricing. And basically, they're saying, hey, you make insulin for X amount of dollars. Why are patients and consumers being charged, this amount of money? And I believe Letitia James, the Attorney General of New York, she actually secured a 5-year contract or an agreement with the insulin manufacturers that even for uninsured patients, that the cost will be $35 a month. So insulin, unfortunately, is the poster child of the dysfunction in our pharmaceutical pricing scheme. And even in Congress, I attended a Senate hearing back in the spring, and there's bipartisan support to reform this at the federal level as to how insulin is being accessed. But again, the Inflation Reduction Act only impacts patients on Medicare, but we're hoping in the future we can impact greater number of lives and patients by applying it through other payers as well. But since you have so many state attorney generals with an interest in this, I'm hoping something can push it at the federal level as well.
Thank you, Erich. I want to turn to you because there are angles and perspectives coming from the NASP. I heard a lot of things talk around rare disease and raising money for rare disease coverage, not only private, but some of our state tax money that's dedicated to that. And was one of the 2 sessions that were there were just all about that component. Then we talk, SEMA talks about how it might impact our seniors. Community pharmacy, I don't feel like I know. It's the melting pot for all instances. You may have a specialty patient. You may have a long-term care patient. You may have, just your average Joe antibiotic patient, but it's impacting your community.
Well, it is. And, just some background to what she spoke to. I'm old. I've been doing this for 29 years. I remember when insulin was less than $50 a vial. You can go to the largest retailer in the country and buy insulin without a prescription for $25 a vial. So the game has become newer, greater insulins, much higher list price, and then we rebate those monies back to the PBM. You flashed up a box of a Lilly product that has Lilly makes their own quote unquote generic insulin that no insurances cover because there's no rebate on it. Mm-hmm. So we're back to this rebate game. We have much higher list prices, and it's the consumers paying for it. The pharmacy, we're at everyone's mercy for this. So maybe they want to peel back that onion a little bit too when it comes to insulins.
What doesn't our Congress people or senators or the state, I think of PPA's relationships with our state senators and helping them to understand, but what should we be communicating even at a Pennsylvania level? This is going to affect the nation, but let's talk about, since Pennsylvania is our state, SEMA, let's talk specifically. What do we tell them? How do we educate them on this?
So Pennsylvania, and this is why it's important, who your attorney general is and who is your auditor general and who are in these key roles in your state, right? So we have Michelle Henry in the attorney general's office, Timothy DeFore currently in the auditor general's office. And basically, you want to bring this matter to their attention. And you can go through your state legislators. You can write to them directly. I mean, our U.S. senators, Bob Casey and John Fetterman, they support, they supported the Inflation, Reduction Act for decrease the or have cap the insulin at $35 an hour for $1 for seniors. But as far as greater impact, unfortunately, in the Senate, we fell short by 3 votes to have it apply to other payers as well. So if we can get more senators on board on the federal level, and then at the state level, you have the attorney general and auditor general that maybe can do some investigations into this issue. That can help at the state level. But I mean, as far as our U.S. senators are definitely on board, Bob Casey and John Fetterman. As far as your Congress persons, I'm not going to call them out by names, but you know exactly who voted to support capping insulin and who didn't. So if this is something that's very important to you, as a constituent and a citizen, vote and support candidates that will support the issues that are important to you, as well as, talk to them and provide education to them. Hey, this is why this is important. I think in the House, there's since in the Senate, we have some bipartisan agreement on how patients and consumers should be able to access insulin. And there's agreement there. I think some work needs to be done on the House side, getting that bipartisanship there. And I think if we can get that bipartisanship, in the House at the federal level, I think we can come up with something very meaningful for all the nation's citizens that need insulin. But like I said, there's support in the U.S. Senate, bipartisan support, and I think in the House, hopefully, if we can get some agreement. And I think, addressing the PBM piece, you may get that bipartisanship there. So hopefully, in the House, if you can urge your legislators, to work on this issue and why it's important to you.
Yeah. What I think is every time you start something, every time there's an initiative, even if the ball is rolling, it takes an immense amount of time to get anything done that actually is meaningful in order to trickle down to the impact of community pharmacies staying in business so that people in their community that have zero healthcare services for miles away in order to have the coverage that they have. I think of, you're in Fayette County, Erich, in southwestern Pennsylvania, and you have 4 locations. But when we start traveling up the mountain, when we start getting into West Virginia, I can think of some community pharmacies that might be 40 miles away of not having any healthcare services except that. And we're now being subjected to what's coming, which is not healthy, I think, for public health, which is big changes to our PBM in paying things at point of sale. So could you just talk about that too and how that's going to impact you?
So, there's a lot of discussion about pharmacy deserts these days, both rural and inner city. Chains are closing stores. And if you would take a look at those closure maps, I'd hazard a guess there's a fair amount of those in inner cities, as well as maybe a town where there's multiple locations of the same. These contracts that the PBMs push down to the pharmacies become more and more restrictive. Makes it really harder for us to provide care in these communities. We're Main Street pharmacies. We're here to take care of the people in our communities. To Seema's point, there's a lot of good things, bipartisan, being pushed at the federal level right now. When and if that makes it to us at the community level, is that 24? No, it's going to be 25 at the earliest. Something as basic, and we're talking a lot about insulin, but something as basic as having the states pay a NADAC, which is a globally accepted acquisition cost for drugs, plus a legitimate dispensing fee in the Medicaid space, helps us to continue to take care of a lot of people in these communities. I mean, we're Fayette, we're Greene, we're Washington County. There's a lot of Medicaid. And if you look at community pharmacy, there's a disproportionately higher amount of Medicaid people we take care of because we deliver, because we package, because we go into these communities and vaccinate these people. Some of these things that she's talking about don't come to pass, you're going to see even worse pharmacy deserts.
Yeah, it does stress me out. Seema, you have also worked in long-term care pharmacy. I want you to share we're talking about people that have limited income. They have specific income per month. They cannot spend any more than what they're spending. And all of a sudden things start to shift that impact getting other medications than just insulin. And I just want you to kind of share some of your experiences in helping to drive policy, as well as your relationship in what you're doing for our state too.
Sure. So as far as, medications in general, I always like to, when discussing with legislators, give concrete examples of, when somebody comes to the pharmacy, the manufacturer goes through the process of getting the drug on the formulary. Then the medication maybe needs a prior authorization, maybe requires step therapy, but you're at the pharmacy now, and that medicine is not being adequately reimbursed to the pharmacy.
They're losing.
And that pharmacy is making a decision. Do I give somebody, their medication that they need for their health, or do I go out of business?
Yeah.
And this is why, this issue is so important, with the pharmacy deserts, with, adequate access to care. This is definitely an access to care issue. If a pharmacy stays in business, never mind, like I said, the manufacturer goes through the process of getting on the formulary. The pharmacy benefit manager puts it on the formulary. You have the pharmacy in network, and then you're at the pharmacy, and then the pharmacy is not getting paid. So all these issues in the pharmacy supply chain need to be addressed so patients can get access to their medications. And at the same time, you're having healthier lives, but they're impacted by this. But
Yep.
This is definitely an access to care issue. And if it's not addressed by legislators, you're going to see more pharmacy deserts. And the reason why Rutledge versus PCMA was so critical and important is because states were taking on the onus of trying to do something about it. I mean, these issues do not go away just because, in the past, Congress turned a blind eye to it for whatever reason.
Right.
So states took it upon themselves to try and address this issue. And then Rutledge PCMA came out that gave them the absolute green light, like, yes, you can go ahead. And now, again, I'm hopeful at the federal level, we can get something done.
Yep.
But we need this, yesterday. Otherwise, we're going to have, I get phone calls from pharmacies, they're getting $500,000 taken away from them in DIR fees. Just, they can't stay in business. Again, patients can't get their medication. I mean, this is not a sustainable pharmaceutical care model in our country.
What is happening? So this is October is American Pharmacist Month. I want to give a shout out to all pharmacists nationally. If you're a pharmacist listening to this podcast, I just want to say thank you for what you do for the nation and doing your work. I know that you sometimes feel appreciated, not here. You are very much appreciated. But I want to shift gears to October. Not only is recognition for what pharmacists do per se, but we know that open enrollment starts on October, is it the 15th? 15th. So, Seema, I have heard, I don't understand it. You may have heard that one of the three big PBMs is not participating or not covering independent community pharmacies that are through the Medicaid.gov website or something like that. And I wasn't sure if you've heard like what is being covered, who gets to be in the network, who gets the coverage, who gets to play within state funds to their and this is where it starts getting heated for me as a taxpayer as to who gets to service customers, clients, and patients in their community and who doesn't get to.
Medicare. Yes. So Medicare. So Medicare, I heard, some concerns from community pharmacists that they may not be participating because of the low reimbursements that is being offered by this one particular PBM. And so there are thousands of pharmacies that basically will not be providing Medicare patients, Medicare patients for this particular Medicare Part D plan sponsor pharmacy services. And again, with the issues of pharmacy deserts, a lot of patients on Medicare have disabilities, they're elderly, and independent pharmacies offer specialized services to cater to these types of populations. The delivery service, your pharmacist, it's the same person every day. And again, if this is not addressed with the reimbursements, with how these contracts are done with the pharmacies, you're going to get these pharmacy deserts. We already talked about that. There are gaps, 30, 40 miles. You're an older person. How do you get there? How do you get your medication? If a pharmacy is 40 miles away.
Yep.
So, this definitely needs to be addressed. And, as far as network adequacy, I think this issue definitely needs to be taken up.
Erich, you have 4 pharmacies. Are they all in the same county, or you have one in Washington County too, right?
2 Washington, 1 Green, 1 Fayette.
2 Washington, 1 Green, 1 Fayette. So if you count the number of state representatives that would cross all 3 of those locations, that's 3 state representatives, I think.
4.
4.
4.
Okay. So the reason is because I think some of our Congress people don't understand the impact of what PBM reform, if you don't get reform, what it's going to do to your state. And so I want to give a shout out to any of our politicians that I send this to, because I am going to send it to you, that if you want to discuss this with a local community pharmacy, we can arrange that so that you can ask questions and we can formulate your plan and put it out to the public and get some groundswell for support for you in many of the coming re-elections and leading up to 2024 too.
I will tell you that I've had meetings with several of our state senators and state reps, have been gracious enough to give me their time and understand who we are, what we do, and our impact on the community. So they're listening, they're trying. Where it goes from there, we'll see.
So one of the plans when we expand home care services, Erich, from the community pharmacy to the home, there's going to be services that you're going to be provided that if you're listed under a classification of I don't know if they call that long-term care at home yet, or if that's going to become the new term.
It is.
But tell us a little bit about that initiative and what you're doing.
Well, I mean, COVID changed a lot of things for a lot of people. Assisted living facilities, personal care homes were closing or had problem staffing, or, maybe someone's loved ones weren't comfortable with the outbreak of COVID at that time. So we had a lot of seniors coming back into the community, but those seniors still need those services. They need someone helping them review their medications, someone packaging their medications. And look, the boomers, there's a ton of boomers, and there's not enough beds for all of them. So CMS recognizes medical at home. Many of the PBMs recognize medical at home as well. It's packaging, it's delivery, it's pharmacist review, it's emergency services after hours. But what we feel is there's an ability for us to keep seniors in their homes. Bigger picture, if the powers that be take a look at this, it's much more affordable to keep a senior in their home for them to go to a facility and ultimately become a Medicaid spend when it's back on the taxpayer dollars in a different way. So, yeah, we're big believers in medical at home.
What about things like remote patient monitoring or things that can be added on to some of this? Have you explored reimbursement for those kinds of things?
We kick the tires, but there's 2 big ugly gorillas in Western Pennsylvania that like to keep all the cookies for themselves.
Well, that's another thing, isn't it?
It
That should be
is.
another podcast.
It could be.
We'll get
One's
some
purple,
other.
one's blue.
One's blue. I wonder what that is. So let's give a shout out to PPA. So Pennsylvania Pharmacists Association, My Home Association, they have an event coming up in November. I think it's November 11th. And I think that Pitt School of Pharmacy will be hosting it. Seema, are you going to?
I will actually be at, we also have an event. If you're on the eastern side of the state, we also have an Eastern Regional Conference. I will be at that one. I'm one of the moderators for the New Practitioner Forum.
What's the date of that one?
That one is Saturday, October 21st. It's at my alma mater, Philadelphia College of Pharmacy in Philadelphia. And you can register online. It's an in-person conference. And it's geared towards students, new practitioners, or if you're a new practitioner at heart and want to hear from individuals from different disciplines. And I'll be there too if you want to see me.
Awesome. Excellent. So Pennsylvania pharmacists, our PPA is very, very active, and we're proud to support you in any way we can. We will be at the November 11th event supporting the PPA. I'm looking forward to seeing some of my Pennsylvania pharmacists out there. But if there's anything that I can do as a podcasting network for the rest of the states, we'd love to advance what OPA is doing out in Ohio and the advancement of PBM reform, as well as standing up for our chain community pharmacists that are going through a lot of stress right now throughout the nation and taking a stand, and some of the walkouts that are taking place, which is controversial in itself. Do you go to work, or do you make a stand? How long is the stand? How long do we go without coverage for our communities? But things have to change, and sometimes you have to stand on the line, unfortunately, to get things to change, because profit organizations, people that make profit, sometimes it can smear the vision of what's best for public health. And I'm like you, Erich. I'm a capitalist, but I'm a libertarian leaning capitalist. And I see political views in healthcare on both sides of the aisle, but I think that we have to have coverage. We have to have tax dollars working for people that can't afford maybe a private insurance. And we have to keep righting the ship and balancing things in order to get people the medication that they need, the healthcare services that they need, and not burdening people with debt that they take on because they have some chronic illness. So, I mean, we know that. We work it every day. We're here. I want to give the mic over to Seema to give some closing statements, as well as anything that you'd like to call out or network with other pharmacists out there, especially if you'd like to do another follow-up podcast. We'd love to have you come back.
Well, thank you for the offer, Todd. But what I want to tell pharmacists out there is, first of all, happy Pharmacist Month. And you are a key piece of the infrastructure of healthcare in this country. And we need you. And not only do we need you, you need to let your legislators know as well that your community needs you. And I think if we garner, and we have garnered quite a bit of support from the advocacy that you all have done over the years, and don't give up. And one thing I am hoping for in the future is for us to get provider status. Yep. I think that'll be key in the investment of our profession. But I'm here with you in that fight, and we're all in this together. And again, happy Pharmacist Month.
Absolutely. Happy Pharmacist Month, Erich.
Yeah. Hey, thanks to all our pharmacists who do an amazing job. I mean, we're running multiple clinics each day this month of giving shots out in the community. We take our shots to where the people are, yep, as opposed to trying to herd them all through the stores. Our pharmacists do a great job taking care of people in the community. It would be interesting to see how many more people we could take care in the community if we had fair opportunities, yep, with PBM contracting. Yep. And if really PBMs returned to their original function, which was eligibility and moving the money around, not playing favorites, not playing reimbursement games, yep, not holding monies back. I think you'd see a bloom in community pharmacy, community retail, independent pharmacy.
I agree. Truly. So if anyone's listening, PBM Reform Podcast, if you would like to come up with a subject that you'd like to drive, even if it's state specific, we love this. We love this content, and we think it's important to get it out to you. Please reach out to me. You can find me at pharmacypodcast.com or any of our Instagram, our social media, or LinkedIn. If you just search Pharmacy Podcast Network, you'll definitely find us. Seema, I want to say thank you for coming in from the East. Go Steelers, Seema. Go Steelers.
No, I'm an Eagles fan. Don't even go there.
At least I can say go Steelers to Eric, right? Are you a Steelers fan?
I am, but how about we say go Pens?
Go
'Cause
Pens.
We're struggling a bit these days.
See, yeah, I know. We didn't have a very good game last time. So, all right. So, but thank you for listening. The PBM Reform Podcast. Shout out to our American Pharmacist Month. Thank you so much for what you do. And we will talk to you next time.